Good evening to all our viewers here in the Bahamas and worldwide. We want to welcome you to another session of Share Your Story. And this has been an exciting time for us as women here in the Bahamas, as we've had women on who have shared their story and their journey with breast cancer. This evening, we will continue the topic on breast cancer, but we will be talking about breast reconstruction. That's a topic that's sensitive to some, and it's really not familiar to a lot of persons because, yes, after going through breast cancer and treatment, some persons opt to have breast reconstruction done, and others opt to have prosthesis or implants and different things. So this evening, we're going to have two women on the panel, along with myself, and we will talk about breast reconstruction. And before I bring them on so that they can introduce themselves to you and tell them who they are, and we'll talk a bit to them about their journey and what's happening and have happened in both lives, I just want to say that we're coming down to the end of this series. Next week will be the final series, and we will be having a special guest on who will be talking about living with breast cancer. You don't want to miss that series next week. And also, we're supposed to have Dr. Curlin on, who will talk a bit about breast cancer and what he's finding and seeing here in the Bahamas with our women. So you don't want to miss the last week. Now, we have said that even though October is recognized as Breast Cancer Month, because breast cancer is so prevalent here in our country, we want to keep it in the forefront of our people and to have discussions on it ongoing on a regular basis. So even after this series, we will take a break and probably resume again in January and have some other different types of discussions related to family, loved ones, caregiver, and other women who are dealing with breast cancer. And we know that it starts very young in our population. We have women who are being diagnosed in their early 20s. And so we will probably bring in one or two of those on for one of the sessions just to share about what their life has been like living with breast cancer and being diagnosed at an early age. So I want to welcome to the show, into the studio right now, two other lovely women. And I will have them introduce themselves. We have Dr. Stephanie Hutchinson and we have Catherine Gibson. And ladies, I want to say good evening to both of you.
Good evening.
I'll start with Catherine. Catherine, please let our audience know who you are and what life is like for you, my dear.
Okay. Really good to be with you, Abby. I think you have done a great job with this series thus far, and it's been really informative, and I've enjoyed it and learned a lot from it myself. So, to our viewers, I'm Catherine Gibson. I am by profession a chartered accountant and certified financial analyst. Currently working as a financial advisor. I am the mother of one, the wife of one, and a year ago, almost exactly a year ago, I would have been diagnosed November 2018 with breast cancer. And that is where my journey started. Stephanie, who's with us this evening, was a great support for me through my journey. And I guess we'll talk more about that later, but that's who I am.
Okay, very exciting. And Dr. Stephanie, please let the audience know who you are and a
Well,
little
hello again.
about your history.
Okay. Happy to be here. I've been following, as Catherine has, over the last month or so, and we both talked about how we were doing the same thing at the same time, but just on different days. And so I thank you for your support of our program, and happy to be here to share with you. I am a Stephanie Hutchison. I am a clinical psychologist. Um, Anybody from Howard is listening, HU, Howard University, several times over,
You
clinical
know,
psychology program. I am currently an assistant professor of psychology at the University of the Bahamas. And as Catherine said, we kind of she was a couple of months ahead of me on my journey, which started last year, January 2019. And I was twice diagnosed. The first time in 1996, and then 23 years later, last year in 2019. And so, two-time cancer survivor, clinical psychologist, one of several siblings, one of 8 siblings, and just very happy to be here to share about this journey. So thank you for having us here tonight.
Okay, good. We will start with you again, Stephanie.
Okay,
You said you were diagnosed previously.
right.
Tell us, how did you find out? What happened in that situation?
Okay, so I was actually on my internship. I was living in Atlanta, Georgia at the time, and I went just for a regular checkup. It was a couple of months, maybe about 2 months after I just turned 30. So you talked about young cancer
Very
diagnoses.
young.
I had just turned 30. So what that means, when I thought about it, it means that that cancer was there in my late 20s, at least at 29. And so I went for a routine checkup, and I was more concerned that I had not had a pap smear in about 2 years. I wasn't, breast cancer wasn't on my radar, wasn't on my mind. I knew about it. I knew that you should do breast exams, but it wasn't something that I thought I'd have to be concerned about. And so during the checkup, my doctor was examining me. She did the clinical breast exam, and she said, "What's this?" And I said, "I don't know." And she said, "Well, we need to check this out." And so she scheduled me for a mammogram the next, I think, a couple of days later. And I did the mammogram, and they were like, "Well, we can't see as well." I think they said because the breasts were dense because of my age. And so they did an ultrasound. Still were not sure about what they were seeing, I guess probably also because of my age. And so, based on a biopsy that they did, the results came back a couple of days later that it was a small cancer. And so, that started the journey in 1996. And then, like I said, um, I wasn't thinking about it coming back after all that time, after passing the 20-year mark. But the second time in last year, I found it. I found, because I had been doing my breast exams, I had noticed changes that I was monitoring and decided to follow up with my mammogram. And the mammogram, the ultrasound, the biopsy, again, confirmed that I had cancer, breast cancer, in the opposite breast.
Now, do you come from a history of cancer or even breast cancer?
Not, I know when we talk about our country, we talk about certain islands that have a lot of breast cancer. So my family historically is from Eleuthera. My father was from Hatchet Bay. My mother's from Harbor Island. And so we've always heard about that in terms of Eleuthera. But in terms of my immediate family, I started the history of breast cancer. My father had lung cancer, but that was, I think, because of his years of smoking. But I started the history of breast cancer in my family. Yeah.
Okay. Catherine, do you want to tell our audience a little bit about how and when you were diagnosed and what happened in your case?
Okay. So I was diagnosed in November 2018. Um, in August of that year, I had had a cyst removed. I think I was sitting in this chair and kind of leaned over to get something and felt a little pain and realized there was something there.
Were you doing breast examinations at that point? I mean, or before then?
I I was. I don't know that I was very diligent about it, to be honest. Um, but I tried to do it regularly. Um, so prior to my diagnosis, actually, I'd had 2 cysts removed um, from the same area, almost under my arm, the left breast. And around, I guess, October, and I don't know if I were doing an exam, but I remember feeling a lump um, in another area of my breast, left breast. And I'd had that, a minor procedure to remove the cyst in August, I think it was. And so I figured couldn't be anything significant. But I called my doctor's office anyway, um, thinking that maybe it was something similar, but because it was in a different area, I thought it best to check. And so I asked the nurse, spoke with the nurse, what do you want me to do now? Should I, schedule a mammogram? What would be the next step? I'm feeling this lump. And she said to me, well, not every little lump you feel, you have to run and get a mammogram or something for,
And who said that again? Repeat that, please.
This was the nurse. She said, not every little lump you feel, you should get a mammogram. And we talked a little bit, and we concluded, oh, okay, I'll watch it for a little while. And that was on me. This is totally on me. I can't even be angry with her because I should have known better. And I think, in fact, I did know better. Just given the circumstances in the Bahamas, um, we know that the incidence is of breast cancer is so high here, and so there should never be a time that um, we do nothing about any lump or changes that we see. We should at least make the effort to inquire. So that was on me to let it ride. But I did that probably for about 2 weeks, and then I called back because I thought it was growing. I thought I could feel it getting bigger. And from that came the diagnosis.
Um, Let me ask you, what treatment process did you go through?
And so I had a mastectomy, followed by chemo. I had an aggressive course of chemo, so I think it was right. It ended with 10 weekly treatments. I do remember that part, and then I think it was every 2 weeks for maybe 6 courses or 8 courses. Stephanie will know because I think we had very similar
Mm-hmm.
regimes. But yeah, it was an aggressive treatment.
How was chemo and radiation for you? How did you manage? How did you handle it? Body physically and mentally, emotionally?
Yeah, I didn't have radiation. Um, Chemo was not as difficult as I had expected it would be. But it reminded me of my pregnancy, and while my pregnancy wasn't high risk or anything, I think I remember one day during that time that I felt like myself. All the other times I just felt ill. So the most difficult part of chemo for me was just the weakness, the lack of energy levels. That was the most difficult thing for me because I get up feeling ready to take on the world, and by the time I had breakfast and packed all the snacks and things I had to take to work with me, I'd have to kind of lay down for 15 minutes to catch myself before I could head out. So, but there wasn't the a whole lot of nausea and that kind of thing because there's a lot of medication to manage that. And the other part that I found difficult was that I had to eat a lot. Um, and I think they give some of the medication is to help to manage to maintain your appetite. And so I'd find myself having to get up at night to eat. Um,
You were one of the few.
yeah,
Yeah.
I don't know what they were giving me, but I think it was the medication. It's not something I'd ever
You
do.
were eating. Wow, that's
Yeah,
wonderful.
and I felt terrible if I didn't eat, and so I'd have to take just a whole bunch of things to work with me to eat during the day because you don't want to hit the snack machine and get jumped. So I'd have to pack up a whole bunch of stuff. It was a real process to getting ready in the morning.
What
But
about hair loss, nails, anything like that?
oh yeah, all my hair came off, and so the one that I think that was kind of one good thing that came out of it because but I didn't wait for it to all fall off. When I noticed it starting to shed, I just went to the hairdresser and had her cut it all off, and and had the wigs, the cap, and everything ready to go. But after I cut my hair, it felt so good. I was like, brother's been holding out on us. This feels good. And after wearing the wigs, and I just couldn't take it because it just felt like too much stuff. Um, and it just felt good to go natural and with my hair low. So I decided to, I'll just stick with this. And that was fine. The nails, I think yeah, they turned black. Um, and the eyebrows and eyelashes, that felt really odd to lose those, gives you a strange look. Um, but in terms of mentally, um, really, I think my faith in God is what brought me through it. I realized that some people said, well, how could this happen to you? You try and eat healthy, and you're faithful, and someone said all that praying, but you know we have to remember, we're not past anything, um, so we're dead, to be honest. And God has given some of the most difficult times and the most difficult tests to his closest servants. Daniel, he suffered so much, um, but God revealed history through time to him, like he did with no one else. So I think, we have to remember that there will be challenges, and that's life. But it's how we deal with them that's important. So, so faith in God and support from family and friends really helped me to get through it.
And you're doing well, and you look well. One
Thank
thing we don't talk about, though, when our hair starts to come back, it tends to come back gray and not the
Yes.
color that it was.
Yes,
You
Mm-hmm.
yes.
know, that was
Yeah.
that was like a shock to me one time when I looked at my photos. I'm like, gee, but that is a reality. The hair, it comes back nice and soft, but it tends to come back a
Mm-hmm.
bit gray. Isn't that interesting?
Yeah.
So these are all the changes we have to adjust to and make adjustments to as we
Sure.
continue on the journey.
Mm-hmm.
Now, Stephanie, I want you to tell us a little bit about your treatment process and what you went through because, yeah, you were diagnosed first and then you had a reprieve, and many years later you were diagnosed again. So tell us what sort of treatment process you went through with both of them.
Okay. So the first time I, both times the cancer was found early. I think it was either not stage zero, but I think it was stage one with the first time. And so that was 1996. And the treatment was the first biopsy revealed that it was cancer. And so they had to go in and remove more tissue to have clear margins. So I did not have a mastectomy the first time. They said they would do breast conserving surgery. So I did a lumpectomy, and I had 6 weeks of radiation. So it was every day, 5 days a week for 6 weeks, about a month. No, not a month. Okay. So I had lumpectomy, and then I had 3 cycles of chemotherapy. So every 3 weeks, I had chemotherapy, adriamycin, red devil, and cytoxin.
Who
Still
can
remember,
forget those?
still no, still remember that. I remember saying, orange urine. Sorry, too much information. So once chemo was done, 3 cycles, I then went into 6 weeks of radiation, 5 days a week. And I remember my doctor saying, just as extra insurance in case there were any cells lingering there. So the first cancer was surgery, chemotherapy, radiation, and the first cancer was in the left breast. Last year, when it was diagnosed, it was in the right breast. And the treatment 20 plus years later was really different because when I did all of my treatment in the U.S. At the George Washington University Hospital, and when I went there, and I had all these other tests done, I found out that the first course of treatment this time would be chemotherapy. And one of the reasons I learned for that was in between 1996 and 2019, I found out that I tested positive for the breast cancer gene. And so I think the treatment protocol, if that's present, and then I was also triple negative for the first cancer, and it ended up being triple negative for the second one. And so, from
Could
what
you
I understand,
explain to the audience, Stephanie, what triple negative means so they would have an
okay,
idea?
okay. So if it's any oncologists on here, you may need to help me out. So the breast, with the testing that's done for breast cancer, there are tests that are done to see if the cancer responds to estrogen
Estrogen,
as estrogen, progesterone, I think, and Herceptin.
Herceptin. These are cells
Herceptin,
on
right.
the
If
breast tissues. Yeah.
right, so if they test positive, then that means that they kind of those hormonal influences fuel or drive the growth of cancers. But if they are not positive, then that means that the cancer is less likely to respond to those hormones in terms of fueling growth. And so
Right.
my cancer tested negative on for all those um, hormone or those variables. And so I was classified as triple negative. And so I was not eligible for the medication that people usually take to reduce recurrence. So I was on no medications between the first and the second diagnosis because I was triple negative. And the treatment, as I said, the protocol was therapy first. And so I had 12 weeks of chemotherapy weekly. So that was a marked difference from the first time. Every week for 12 weeks, I went for chemotherapy. Carboplatin and Taxol was the regimen this time. And then once I was finished with those 12 weeks, I took a break for about 4 to 6 weeks. And then that's when I had double mastectomy and immediate reconstruction. So, as I said earlier when I was sharing with others, I said they deconstructed me. They took me down to the studs, for those of you who do with construction and are familiar with that analogy. And then they reconstructed breast tissue from the extra fluffiness I had in my abdominal area. And so that's the DF flap. So they use my own tissue to create new breasts. And I was going to say something about that, just skip for a minute. So, second time, 12 weeks of weekly chemotherapy, a little bit of a break, and then reconstruction. I could have opted to have the reconstruction later, but I didn't want to do that. So I had everything done at one time. So that was a long surgery. It was 12 hours long. And once that was done, that was the bulk of my treatment that was complete. And so, yeah, that was most of last year, from about February to August of last year, in terms of chemotherapy and surgery.
Now, the topic this evening is reconstruction because the three of us did reconstructive surgery. Two of us did pretty much the same, and one is different. And why reconstructive surgery is important, because once you're diagnosed as a woman and you choose the process of mastectomies, removal, you have to decide, do you want breasts going forward, or are you going to live with prosthesis going forward? And so it's a decision most women will have to make if they've had a mastectomy, whether you had one removed or both removed. Now, I remember an aunt of mine when she was diagnosed, and she was diagnosed in her late 30s, I guess, or 30s into 40s, one breast. So she decided she had the mastectomy of one breast, and she went for prosthesis. And back then, that was probably the course of treatment, because if reconstructive surgery has advanced quite a bit in the last 10 plus years at least. But the option back then really was implants. So she had an implant done. And, after having that done, as she aged and going into menopause, she became frustrated because she said when she looked at herself in the mirror, one breast was standing up straight and the next one was going down south. And that really bothered her. And, she was a young, sexy lady, quite energetic and always looking nice. So for her, that became an issue. When she talked about it over and repeatedly, and she said she don't know why her doctor probably didn't advise her to do a double bilateral mastectomy and have implants in both, as opposed to having one like that and one different. So these are issues that women have to deal with psychologically, emotionally, because we look at ourselves every day in the mirror and going through all the different, first of all, when you go through breast cancer, all the changes you go through with your body with breast cancer, treatment process and all of that. And then now you have to make a decision concerning, should I reconstruct my breast? Should I just live with having, just platforms, or should I have implants? So I want us to transition to talk about reconstruction. Now, Kathy, after you were diagnosed, what course of treatment did you decide on? Once you had both removed, right?
No, I didn't have a double mastectomy.
Just one. So,
I opted to go with just one. And and the reason I did that,
what did you opt to do?
so I went with an implant,
Okay.
um, saline implant, which is considered maybe a little bit safer. But I opted not to do the bilateral because I I prefer not to do any unnecessary surgery,
Mm-hmm.
any surgery that isn't totally necessary.
Mm-hmm.
Um, and my understanding was that I wasn't at an increased risk of cancer in the other breast. Don't have the BRCA gene. Um, and going into it, it doesn't seem so important because you're looking at cancer, which could be life or death. Um, and starting out, it seems like that. It's not necessarily like that, especially if you're not late stage. And even if you're late stage, it's not necessarily that. But anyway, it's just getting the diagnosis is just such a shock. And, you know, my primary concern was my health. So my thinking was, I don't want to have any unnecessary surgery, um, unless it's going to be a great benefit. So an appearance, at that point was not a huge thing. Although I knew I didn't want to just have the mastectomy and just leave it. Um, and I did talk with my doctors about options for people like your aunt and myself who would have the benefit of an implant and then the impacts on the other side of gravity and breastfeeding and all these years on the earth. So there are options and to
Why did
deal with
you
them.
decide on that particular option? Why were you most comfortable with that, or why did you decide on an implant as opposed to a reconstructive procedure?
Oh, because I only wanted to have, I wasn't going to go with bilateral. I was only removing one. And so the recommendation was, well, if there were ever um, an occurrence on the other side, if I'd already done the reconstruction, that wouldn't be an option at that point. Um, so I opted to just go with the implant.
Now, let's talk about the implant. What is the
Mhm.
implant like? Let us tell our audience, what sort of implant do you have, and I mean, whatever you want to share and whatever you're
Yeah,
comfortable with, in
right.
terms of sensitivity, touch, all these different
Hmm.
things.
Right. Um, so it's saline, which is the salt water, saline solution. It from the appearance and the touch, I think the feel is very similar to a natural breast. I guess, these things have advanced. So from the appearance, you wouldn't know that um, it's not natural. Sensitivity, that's not there because all of the breast tissue has been removed. So in terms of sensitivity, that's not there. Um, and I'm certainly glad. I'm glad I went that route because, um, like I said, I wouldn't want to have nothing there. Um, there are still, because I didn't get two implants. I didn't do the bilateral. There's still that lack of symmetry, and I just deal with that with the mastectomy bras and the inserts, the breast forms that help them to look more symmetrical. And I would be able to do more cosmetically in terms of surgery on the other side, but that's not something that I want to deal with at this, especially not at this point. Um, just after going through the surgery and chemo, for me, I just feel like I want to stay away from that for a while. So
Mhm.
still doing all the follow up and the flush your port and that kind of thing. But so at some point, I suppose I'll get around to making some adjustments on the other side. But at this point, I'm okay with just working with the inserts and having this other side as it is.
But one of the other positive things with the inserts would be you could determine the size you want and how you want them to look. That's the one good thing about the inserts and the implants because if you were smaller, you could get them bigger. If you were bigger, you could have them reduced. But if it's just one, you have to make sure it's symmetrical as close to the other one. But if it's both, then you can go as big as you want or as small as you want. So women have to decide whatever they feel like at that point in time.
Yeah.
So Catherine decided to go with implants. And a lot of women today are having implants done. They are much safer now as they were before, but you have to make sure you're following up with your doctor closely and seeing them on a regular basis to ensure there is no leakage or anything like that. Now, Stephanie, you decided to go with another option. I want you to let the audience know what option you chose.
Okay. I actually did not know about the option I chose until it was brought up by my doctor. I was familiar with the implants because one of my very close girlfriends had done it before, a few years before. So when I was diagnosed the second time, I had the issue that Catherine mentioned now. I had the lumpectomy, but 20 years down the road, the lack of symmetry. So I had been dealing with that for 20 years in the inserts, and I did not like that. I wanted it to look more symmetrical without having to stuff the forms. And so when my doctor told me that not only did I have cancer in the right breast, which was different than 20 years before, they were beginning to see what's called DCIS, ductal carcinoma in situ, beginning cancer in the left breast, the original breast. And so at that point, I knew that this was not going to be just a one breast mastectomy and done. I knew that they would have to do something with both breasts. And right off the bat, my surgeon recommended bilateral double mastectomy with reconstruction using my own tissue. That's kind of an easier way to think about it. And one of the reasons that was my option was because I had had radiation on the left breast in the first cancer, and it was much smaller than the right. They would have to do more building and contouring when they had to do the double mastectomy. And so she said I wasn't a good candidate for implants. And because I had extra tummy fat, That's what the fluffiness I was talking about. They are able, using the DF or the deep flap procedure, to remove that excess skin, tissue, blood vessels, and reinsert it, or like put it in like an envelope, for one of a better word, and they use that extra skin and fat to build new breasts. And so not only did I get new breasts, I also got a tummy tuck, because when they moved that extra skin and fat, they kind of had to close it up, so I was a little smoother, um, in terms of that. I had like a flatter tummy, in addition to them moving the tissue up to the breast. And so that was microsurgery. I think that's one of the reasons why it took so long, because they have to make those connections and make sure that the blood vessels are flowing, and the tissue remains viable, and that it's a successful surgery. And so that was the option that my doctor recommended. I'd read about it before, but I wasn't even thinking that that was something that I would want to do. But I think it was a better choice for me, because of what had happened with the radiation and what it had done to the breast 20 years earlier. So I have a more symmetrical appearance, and I don't have to fill anything in my bra. It's just, and they've kind of settled in a more natural state. I remember surgeons saying they will gain weight and lose weight as you do. So it's my own tissue. Like Catherine mentioned, though, I can feel when I touch my breast, I feel I feel pressure, but it's not necessarily as sensitive as before. The best way I can describe it that people would understand: when you go to the dentist and you get numb for an extraction or dental work, and then you would touch your face and know how that feels when you've done that. That's what it feels like. Like I can feel the pressure, but if I itch and I try to scratch it, it doesn't penetrate deep enough for me to scratch. So I have to do, kind of like when women have weave and they have to do this. That's what I have to do to kind of relieve if there's itching. Catherine, you know what I'm talking about. You can't scratch. You have to hit to kind of penetrate. But I can feel the pressure, but I don't feel it as pain. So I could probably get stuck in my breast and I won't feel it. I'll just feel the pressure of it. So yeah, so that's, and so that part of the surgery was done, and they usually don't do nipples at the same time. This may be too much information, but we're talking about reconstruction, so let's talk about reconstruction. I opted not to do surgery for nipples because, like Catherine, it was just too much. After being under general anesthesia for 12 hours and 4 or 5 days in ICU, not because I was sick, but because of the around the clock care I needed to make sure that the implants, not the implants, the reconstruction remained viable. And so all that time in ICU, all that medication, all those drains, I just did not want to have to do another surgery to have implants. And so I figured down the road, I'll probably opt to do these wonderful inventions. They do nipple tattoos now. And so maybe in a year or so, I might decide to do that. So that's my journey in terms of reconstruction.
Now, let me ask you something, Stephanie, because I'll just talk briefly about mine also, which was similar to yours. Do you have a cut from one side of your body to the opposite side in your tummy area when they
Yes,
remove the fat?
yes. I am from one side of my hip to the other, but it's like below the bikini line, so you don't necessarily see it. And I checked with my doctor just about 2 weeks ago, and he said it's healed very well. It's healed nicely. So you won't see it unless I would show it to you, and then you can't see it unless because like I said, it's very very near to the bikini line. So, but from one hip to the next, I felt like
After
Frankenstein's monster. When I saw all the stitches, I was like, wow. Yeah, but it's healed very
after
nicely,
having
very
that
nicely.
tummy tuck, though, were you painful in that area? Did you go through, or was it
Pain,
comfortable for you?
pain was not an issue for me at all. My the
Obviously, you
what
had
they call
quite a
it,
bit of tissues to
they
transfer.
I have that's what I'm saying. The pain management team at GW did a fabulous job, because before I even went into surgery, I had an epidural. So they did an epidural, and I think they were telling me that was more for controlling what could for controlling the pain from that area. So I had an epidural. I had some other stuff implanted in that was giving me medication around the clock, and then I was having oral meds. So I really didn't have any pain. Um, the only thing that happened right after surgery, because of the epidural, I couldn't feel my left leg from my groin to my toes. I couldn't feel it. They would tell me to lift my leg, and I lifted, and then I said, "Am I lifting it?" And they're like, "Yeah, you are." But I told them, "I can't feel that. I can't feel that." And so I got a little alarmed. And so what they had to do was turn down the epidural a little bit so that the feeling would come back, and that's what happened. But they said it would like be breakthrough pain. So it was just a little bit like that first day. But after a while, when they would do the pain ratings, when they did their checks, I would tell them it was either 0 or 1 because my pain was very well managed, that I didn't really have any. And after a while, I refused the oral medications because I really didn't need them. So it
Well,
wasn't
let
painful.
me let me
Yes.
just share briefly about my experience. I was similar to Stephanie in that being BRCA positive, but I was not triple negative. I was positive, so course of treatment was different in my case. However, after having 1 year of treatment, my oncologist advised me not to consider any sort of procedure after that. She felt I needed to give my body a break. And so I did. But in the meantime, I went and I had consultation for reconstructive procedures. Now, I did not want the implant because being BRCA positive, all that I had gone through, I did not want anything foreign in my body. So in my mind, it was either reconstructive or I would just live with using prosthesis, but I did not want an implant. So that was ruled out. Anyhow, my first consultation for reconstructive procedure, when I saw the doctor, I went to a center. Interesting enough, my girlfriend from college, she was going along with me in my journey. And she was watching CNN one evening and saw this lady who was a fitness instructor talking about how she went through breast cancer treatment. And she was looking for an option for breast reconstruction. And she went to this center in Louisiana that deals strictly with breast reconstruction. That's all these surgeons do. And so she sent me the information, and I called and scheduled an appointment for consultation. So when I went and had the consultation, and I have really nice round hips. So I was thinking, I have enough fat tissue in my hip area that I can use that to rebuild my breast tissues. But after the consultation, the doctor said to me, "My dear, you need to go home and gain some weight, at least a minimum of 20 pounds in order to have reconstructive procedure." So I had to come home and eat to try gain some weight. And I gained about 25 to 30 pounds in my tummy area. So I was ready to go back for the procedure. I was scheduled for the procedure and I went. Now, when I was doing chemotherapy, when I did my first chemo treatment, I was so sick that they wanted to put me in a wheelchair to bring me home. But I said, no, I have to walk because I can't imagine people seeing me coming out of the airport in this wheelchair. And they will say, oh, Dr. Jackson is on her way out. She's dying. So my pride had me, and I said, no, where it takes all night to walk from that plane into customs and out of that airport, I will do that. However, when I went for reconstruction and I had bilaterals, the next morning when I woke up, I thought I had made the wrong decision. I was in so much pain, I could not believe what I was experiencing. But the doctor said to me that you have no fat. So when they sewed me up from one side to the next, the pain that I felt in my abdominal area, I could not believe it was happening. And so that weekend, and just how you said about the numbness of the leg, yes, I started having numbness of my right leg, no sensation, and that had me worried. So That entire weekend I spent miserable because I felt I may have made the wrong decision. I was in so much pain. So when I saw him for a follow up that Monday, they pretty much had to put me on a drip and had to revive me. But I said to my husband, I was calling for a wheelchair because I was not walking anymore. I wanted a wheelchair from the moment I left my hotel straight to my car in Nassau. I didn't care who saw me. I didn't care what they thought. I was just in so much pain. And when I returned home, I had to sleep in a recliner for at least 8 solid weeks. I could not do anything. And my brother was being ordained for pastor in November, and he came to see me. And he said, after seeing me, he said, you don't have to come for the service. I could understand what you're going through, but my situation was different from yours because I didn't have sufficient fat tissue. And that's the thing, because I've met so many women after that who have sufficient tissue and their experience was great. So the thinner you are, the worse the reconstructive, if you're going to use the flap on your own tissue. So that is something women out there have to know. Make sure you have sufficient fat on you when you consider it, because it can be a rough surgery. I think maybe after 3 months was when I started to feel normal again and able to move about comfortably until, bit by bit, I regained my strength and started moving again. But that to me was one of the worst procedures I've ever done. But I'm happy with my decision because, like you said, yes, you have symmetrical breast tissue. There is no, you touch them and you can feel them. However, there's no sensation as the real breasts that you've had previously. And then, yes, I opted for nipple tattoo. I could not save my nipples because some people do nipple sparing and they save their nipples for reconstructive procedures, but I could not because of my situation. They had to get rid of everything. And so I went back, about a few months later and had the nipple tattooed. And so even now when my doctors would see me and they said, wow, your procedure, these are some of the best breast procedures I have seen, because, as the surgery continues to evolve, they're improving on it. Earlier in it, a lot of women had difficult situations because one breast was bigger or smaller than the other one, and so on and so forth. But doctors are now improving in terms of technology and how they do it. And so I am so much happy with the decision, but I did not like the process. And I don't know if if I had to do it again, if I would have considered it, knowing the amount of pain I would have been in, because I did not have sufficient fat tissue. So that is something.
Can I jump in? I just think,
Mm-hmm.
I think what you're saying there is that in addition to that, to make sure and to really talk to your doctor about what the pain management plan is. Because yours would have been about 10 years ago. Your surgery would
Yeah,
have been about
about
10 years
10.
ago.
No,
So,
about 8 years
so
ago. 8 years ago.
about 8 years ago. So 8 years ago. So that's, almost several years between our surgeries. And I think that pain management program that they have in place to probably address some of the issues that you were talking about, to make sure, because I think if I had not had the epidural put in before I even went into the operating room, they put that in first. And then all the other stuff that they had in place, that was directly to target the pain that you were mentioning. And so I think probably the feedback from women who've had experiences like yours may have informed current practice, because there really was no pain. I was amazed. I felt
No,
no pain.
the thing was, all the pain management was there.
Okay.
However, once it wore off, it was just unbearable. I had to stay on medication to keep me comfortable. But as they said to me, because I was so thin, once they sewed me back up and I had to straighten up or move, it was just a horrible experience. But pain management was there. I could have
Okay.
stayed on drugs for however length of time, but I had to come to reality in terms of you need to come off of these drugs. and your body need to adjust to a way of life. So moving, any sort of movement for me was painful. If I turned to my side, it was painful. So of course you learn to sleep on your back after you've had reconstructive procedure also, and even the
We had to. We had
mastectomy.
to. We
Yeah,
had
you.
to. Yeah, we had to for. I had to for 4 solid weeks so that I would not disturb the new connections that were
Yes.
forming. And because I remember my doctor, my very wonderful doctor, Dr. Teresa Busher, who's now retired. I was her 680 something patient she'd done that procedure on. I remember she said, saying, someone started to sleep on their stomach and it messed up the
Yeah.
process. So I had to sleep on my back like you for 4 solid weeks so that the healing and the connections could set and grow and get stronger.
And what's interesting about it, as you said, they take blood vessels along with the fat tissue, and they reconnect the blood vessels to vessels that are located in the breast area. And they listen to them to make sure that they're moving and connected and functioning well. And once the
Yeah.
connection goes, your breast tissues continue on. But yes, as you said, if you lose weight, your breast will shrink. If you gain weight, they will become fuller. So you get to control their size to a point, not like
Yeah.
Catherine and those who have, they determine a
Perky.
size and that size stays perky for however. Our
Yes.
size change with our diet and lifestyle. So if you become
Right.
too thin, they will shrink. Now, Catherine, how are you, as you talk with other women who may have had your procedure, what sort of feedback do you get from them?
Um, you know what? I haven't talked with anyone that that had implants, to be honest. Trying to think of. Um, no, I really haven't had the discussion.
The opt or discussion with anyone?
Yeah, yeah.
As time goes on, though, you will meet up with women who will ask your opinion and advice on it. Um, I see and talk to women all the time who tell me about it, but there's nothing much I could tell them about it now. I could tell them, like Stephanie and I, about the reconstructive procedure, and that's something I recommend too to a lot of women. However, it's costly. And I don't know, Stephanie, if your insurance covered it. My insurance covered a
My
portion
my
of
my
it.
insurance covered everything. I there were months I remember before being diagnosed where I wish I didn't have to pay this premium, but I was oh so glad that I had because everything was covered. Um, the what I had to pay out of pocket was a drop in the bucket to what I think that surgery cost. I don't even want to know because of just the sheer amount of people who were on that team who were in my room that morning preparing to go into surgery with me. I could not imagine how much that cost. So I'm very glad that my insurance covered that.
Yes,
Um,
reconstruct. Sorry, you can go ahead, Catherine.
no, one really good thing I think that Stephanie and her family did when she was having the surgery, um, they got a team of people together to pray for her from the start to the finish. Every hour, they assigned a person to each hour, and they provided the names of the medical personnel that were assisting in that part of the procedure. So if you were praying,
Yeah.
you knew to pray for Dr. Sonia there.
Yes.
Um,
Yes.
all along the way. And I thought that was such a beautiful thing. And
Yeah.
then it
That.
must have given her such a sense of assurance to know that
Yes.
people were praying for her for the entire duration of the surgery. So I thought that
Absolutely.
was a really wonderful thing.
Yes.
A
Yes.
lot of times you have
Yes.
to wonder how people make it without God dealing with
Hmm.
cancer or any major illness. But the three
Mm-hmm.
of us can attest to the fact that without God, we don't know if we would have been to the point where we're at today. And so
Hmm.
Yeah.
we are so grateful and thankful to Him for what He has done and is doing in our lives. And the thing about it is,
Yes.
as much as we may not like it, it provides a platform for us to be able to share and tell other women about it, assist them, come alongside, and be a voice for women in our country. because there are
Right.
so many things and issues that we need to discuss. Insurance, in particular, in my case, in Stephanie's case, when you're BRCA positive, many of these insurance companies want to drop you or
Mm,
don't want to cover you, especially if they know it's there or even in your family. And so
mhm,
these are issues that we have to begin to put to the forefront and advocate for, because I'm sure there are a lot of Bahamian women who were BRCA positive in the Bahamas and have no insurance. And I say to women all the time, listen, if you're able, please get medical insurance, because you don't know when you will need it. And I know in my case, yes, and being self employed for one. So that was something I carried for many years and not even thinking, because as far as I was concerned, I was a healthy person. But when I
Right.
was diagnosed, I don't know if I would have been able to get the sort of care and treatment that I got if I did not have medical insurance. So, women out there, if you're listening, if you're thinking, oh, that premium is too high and I want to drop it, please carry it for as long as you can, because,
I would agree. I would
relax
agree.
the shoe, the dress, the whatever have you, and make that a priority, because it is definitely needed. And Stephanie,
And
you could talk about that.
to not have that headache about what you have to come up with. When I went to George Washington Hospital, I showed them my card. It was approved because they had to do pre-certification. I just went into my appointments and I had so many. I had breast MRI, I had ultrasound, I had echograms, I had more biopsies. I had so many tests done. I had liver scans because they saw something on my liver, and all of this was before chemo. But my insurance covered everything. They covered my hospital stay. They covered putting in my port, taking out the port, all that medication, every week going for chemotherapy, the blood tests that needed to be done, the surgery, all of that, the follow up visits, the physiotherapy, so that I could have mobility back in my arms after the surgery. All of that was covered by my insurance. And I remember thinking one time a few years ago, you know what, I could just put this money aside in case I got sick. If I had done that,
yeah,
I wouldn't have had anything. That would have been gone probably with the first set of chemo. I don't know what the cost is. I just know
yeah.
it's
That
cancer care is
self-insurance
not is
doesn't
not
usually work.
yeah, it doesn't. Yeah. So I'm glad that I did it. And I remember when I came home after the first cancer and I was trying to get insurance. I remember my insurance agent said others at his work were surprised that I was even able to get health insurance. But what
Yeah.
they had done is they had me pay a very high premium for the first 3 years, and then once I was out, I guess at the 5 year mark, they dropped it to a more lower level, and so I was able to get health insurance when I came home, even after I had cancer. And like I said, I didn't know at the time that I was BRCA positive until many years later. But I maintain my insurance through my group through the group plan that I'm in. But I'm very thankful that I had it because I think it made the difference and it gave me more options for treatment than I would have had if I did not have insurance.
Yeah,
Yeah.
and every year the premium goes up, but you try to maintain it for as long as you can. If you're in a group, you're fortunate. One like me, I'm
Yeah,
paying it singly, so I
right.
pay a hefty chunk, but I'm trying to carry it as long as I can. And I said, Lord, if I don't have insurance, I have assurance from you,
Yes.
because you will
Amen.
continue to keep me as long as your plan and will is for me. And so for that, I am truly grateful. But reconstructive surgery is an important issue and topic that women have to consider and face if they have insurance, for one, and if they're able to do it. I'm thinking implants would be a little less, right, Catherine?
Um, I would think so, just because of the time involved. And I really don't recall what it cost. My insurance covered it. I would think it would have to be significantly less than reconstruction that you guys did with the flap. Um,
Yeah.
but still costly nonetheless because it's a medical procedure and you have the surgeons and the operating suite, etc. So there's significant costs attached to it as well. But one thing I wanted to say about, the sensitivity around insurance companies dropping people when they find out they have conditions like, testing BRCA positive, is that it serves as a deterrent to people providing information.
Yeah.
And that's so important, especially in our environment, as doctors here try to understand what's going on in our community with respect to the level of cancer. Because I remember when they were doing the test to determine what percentage of Bahamian women were BRCA positive, and they were asking for people to come and be tested. And I heard so many people say, I'm not going to do that because if I'm positive and the insurance company finds out,
Yeah.
I won't be able to get coverage. And that information that was garnered from that testing and the studies that were done around that has been so important to supporting treatment and the development of treatment here in our community. So I think, and I don't, maybe it's for consumers to advocate with the insurance companies. I'm sure it's going to be a combined effort, doctors, government, etc. But that's something
You know
that
what
has
you
to be
mentioned.
dealt with. Go
Uh,
ahead,
I,
Stephanie.
I, I smile when you said that, Catherine, because I think I was oblivious to the ramifications of testing. Because
Mm-hmm.
when that first cohort of women were tested, I was in that cohort. And I just
Okay.
remember hearing that they were doing testing for the breast cancer gene, but not really appreciating what that meant and what it could mean in terms of insurance coverage. And so I just
Mm-hmm.
kind of sauntered up there to the Cancer Society and did the test and found out later that I tested positive. That's how I knew, because before I didn't know that. I already covered by insurance, so I wasn't dropped or anything. But
Mm-hmm.
I did not realize that that would happen or that could potentially happen. I think when the recruitment for others for the second wave, I think that became more apparent. And also what the recommendations are if you are tested positive to do what they call a prophylactic mastectomy. Mastectomy is removal of healthy breasts or
Mhm.
and moving your and removing your ovaries and
Ovaries,
fallopian
yeah.
tubes to reduce your risk of cancer and ovarian cancer. So I did not consider all of those as recommendations that would come if you tested positive.
You know, it has to be a conversation with legislative insurance companies, insurance executives, and even women. And so these are things that have to be put to the forefront. And women, we have to rise to the occasion because most of our men legislative are males. And we need to educate them more as to what's happening with women and breast cancer, and for insurance companies to say, listen, you cannot discriminate against someone who may have a genetic predisposition that they have no control over. And so these are things that we have to begin to push and advocate for as time goes on. But hopefully, you need to be in that seat of power in order to be able to do it or to influence others to. So when you have your conversations with your legislators and people who come and ask for your support, these are things we need to be asking about and advocating for, because too
Yes.
many women are being diagnosed with breast cancer on a regular basis here. A lot of BRCA and some are not. The majority, though, are not BRCA positive, but the ones who are,
Right.
they are at risk for not being able to maintain or get insurance depending on if the company finds out and something were to happen. So these are ongoing issues for us. And, I say the reason it happened to us so that we can begin to advocate for a lot of other women who won't have the
Right.
opportunity to do it. And so
Right.
discussions like these need to be ongoing, and we need to keep it in the forefront of our Bahamian society, and we need to speak to our member of parliament about it on a consistent basis so that they would know these are the issues we need to be talking about as women here in the Bahamas. But as we begin to wrap up, Stephanie, I would like for you to tell your audience, what have you learned in your journey, and what advice would you give to women out there who are listening to you, and some of the men also?
Um, what have I learned? Um, I was away for almost 5 months for the first part of treatment and then having to go back. I learned through that because I was pining to come home. I learned through that most of my lessons were spiritual in terms of releasing the time that I was there to God for Him to do what He was going to do in me. Recognizing that the experience that I was going through was not just for me, but that it would be a platform somehow to help others. I think doing the pink elephant in the room last month was a step in that direction. I don't know how far that will take me, but I know that my experience was not just for me, but to be an encourager and encouragement to others who are going through tough times. Because in the middle of my treatment, my mother died, and that
Wow.
eclipsed I'm having cancer, because that's my mother. My mother died. I'm having cancer. My mother dies. So that was a lesson that I learned, releasing the time to God, recognizing that the experience was not just for me, and trusting in God's sovereignty for what happens in my life, and to kind of seek and to search out my purpose and living that in all the little tasks and assignments that come my way, and just to try to be an encourager to people who are going through challenges. For us, it was breast cancer. For some, and my mother's dying, my mother's death. For others, it might be something else. It might be encouraging people who are going through tough times now with COVID. And so I think those were the deeper lessons. And also, Catherine mentioned it about my prayer chain or prayer group, the importance of family and support. I call them my tribe. They were my tribe. They prayed for me. They visited. They encouraged. They sent texts. Their prayers carried me through that experience. And so, just relying and tapping into your tribe to support you through that experience, because I could not imagine going through that without them. So that's what I would share. What I learned.
And for you, Catherine, what have you learned? And what advice would you give to those who are listening?
Yeah. I think like Stephanie, it was a time of spiritual growth for me. Um, a time to put things in perspective, to realize what's really important, and sometimes we say what we think is most important, but we don't necessarily live that way. So it was a nudge to just cherish those things that are important, those people that are important, and to savor just those opportunities to share and be with them. Um, and what I'd say to people that might be facing a cancer diagnosis or any challenge really is to recognize that challenges will come, and they come to strengthen us. And I know to some people that may sound trite. But if you think about it, how many times have you faced challenges and once you've gotten through them, you realize that you can do so much more,
Mhm.
that it wasn't as bad as you expected,
Mm-hmm.
that what you went through is helping somebody else go through something similar.
Mm-hmm.
So to me, this strengthens my witness. It's it's a part of a story that I can share to tell about what God has done for me, about His grace and His goodness.
Amen.
So I think there's a lot of good that came from that. And I'd also say to people that are facing a diagnosis or worried about facing a diagnosis or not worried at all, and I'd say control the things you can. There are so many things that so many factors that cause cancer and so many different types of breast cancer even. Um, and so sometimes we hear about, the natural treatments, and nobody could tell you exactly how many and what size soursop leaf you should be drinking in your tea.
Yes,
Um,
yes, yes.
so do what you can with the things that you can control. There's a large percentage of what contributes to this that's controllable. Diet and exercise will help almost anything in life. Okay, it's going to help your mental health, your physical well-being. And so do those things. Eat sensibly. Exercise. Um, just take time, sleep, rest. Um, take care of yourself, your spiritual health. You know, read, pray, meditate, however you want to do that. Um, those are things that are important. There are environmental things that we have no control over. Um, other factors that, when you hit menopause, when you hit puberty, those things you don't control. So there are those environmental things that you have no control over. But don't let that be an excuse not to do anything, because there are some things that you can control, and they may not keep it away altogether, but they may impact how well you're able to deal with cancer if it does come upon you. So, seek to be informed and do the things that you can, to have some level of control over the situation. You can't control everything, but work with what you can.
Such powerful advice from both of you ladies this evening. You know, when you when you hear that big word cancer, that you have it in your life, it grabs your attention almost immediately. You forget any and everybody else, and you begin to concentrate on you. And that is what it does. I'm sure, I don't know, both of you, when you were diagnosed, Stephanie earlier and then later, if the question was, why me? And when you look back and think about it, you're probably now saying, Lord, why not me? Because
Hmm.
you know that He has a plan and will for your life, and whatever
Absolutely,
you may be going
absolutely.
through, He is going to be there with you um, as you go through the process. So for us, it has been a good and a bad experience being diagnosed with cancer. But I'm sure, as with both of you, it is opening doors and opportunities, and you will continue to be an encouragement to somebody. You may never know who,
Hmm.
but down the road, you're encouraging others and building their faith for whatever challenge or difficulty they may be going through. And especially in this particular COVID environment, of course, where people are being challenged and people are dying quickly. I mean, cancer, you go through all the different treatments and so on and so forth, but COVID, people are dying really quickly, depending on their comorbidities or what's going on with their bodies. So for the three of us, we're just so grateful and thankful where we are. For me, it's 10 years, and I, I tell people this is a thankful month for me. I am grateful and
Yes.
thankful because my mom went with it at 51. I have surpassed
Hmm.
that. And so every day is a day of thanksgiving. And once I'm up and I can move and I can see the world, I am ready to face and handle any of the challenges that will present itself. And I'm sure it's the same for both of you. So, ladies, continue to spread the word and let people see your joy, your strength, and your recovery, because you both are truly strong women of God and strong women who He has placed there for a reason and a purpose, to impact the lives of many others and to let them know what He has done for you and that He can do for others. So continue to live on and enjoy. I want to say that, and I have to mention them, the Cancer Society of the Bahamas. We must continue to support them because they provide a home away from home for many persons who are dealing with cancer. And so please, let's continue to support and give to them financially. Let's continue to raise funds to help that particular institution. And then the sister group, Nurse McPhee and those, they are doing a wonderful job supporting men and women who are dealing with breast cancer and even other cancers. They have extended themselves and opened up to support as many persons as possible, but mainly persons with breast cancer. And so we want to give to them. And then finally, the Janie Dane Cancer group of ladies who support each other in different ways. I said, and I will continue to say, COVID slowed down the amount of cancer support events for October because everyone likes to attach themselves to October for breast cancer. But I've always maintained that people have used that as an opportunity to make money and to just give a little portion to an organization and pocket the rest. It didn't happen this year, but I hope people would begin to recognize that when you put something out there for breast cancer, let's use the monies to give to support breast cancer, because many women in our society are being diagnosed and have no means, but still, women, we have to take responsibility. Try to get insurance. Try to take care of your health. I mean, smoking, you need to, especially as you age, smoking, any bad habit or anything that you know can possibly predispose you to an illness, you want to get rid of that. And as Catherine said, diet and exercise is key. These are some of the things we could control. So make sure, do your self-examinations. Make sure, check yourself and not self-diagnose. If you're feeling something out of the ordinary, please go and have it checked. Because you may not feel a lump, you may not feel something, but cancer could be growing. And in a lot of cases, women in our country, they're diagnosed, a lot of them at stage 4 with breast cancer before they are diagnosed. So please, women, let us listen to our bodies, let us be proactive, and let us control and do those things that we can, and the Lord will take care of the rest. So I want to say thank you to our audience again this evening for continuing to support the journey of Share Your Story. One more week to go, and that will be the final episode in this series, and I'm looking forward to that. So I want to say thank you again to Dr. Stephanie and to Catherine for coming on this evening and sharing with the world your journey with breast cancer and about breast reconstruction. This episode has been brought to you by Palmdale Vision Center, and I have to continue to thank my husband for the support and work he's doing behind the scenes to ensure that this program happens. Thank you all, and have a wonderful evening. And you two ladies, don't leave us yet. We'll have a little brief discussion. Thank you and good evening.
Good evening.
Thanks, Abby.